Hey, what's up YouTube? What is happening? We're back here with a new video today, and we're going to be talking about unusual causes of low back pain. Now, before we jump into this video, you probably noticed something different about me. And yes, I did get a haircut. So the long hair is gone, short hair is in. And if you guys have been following me since day one, I kind of fluctuate between the long and short hair. So I hope you guys enjoy the haircut. And other than that, let's just jump into the video today. So, unusual causes of low back pain. So when we're talking about unusual causes of low back pain, this is, the case where someone has maybe a tumor causing back pain, a cyst, maybe there's some kidney, liver problems going on that could be triggering some back pain, or maybe something related to their diet, something that they're eating that is causing back pain. A lot of unusual cases and not of the norm for people in terms of the cause of low back pain, but it does happen. And I want to raise awareness in this video and to share with you guys a story, actually a very important story, and this is kind of a great example of why it's important to talk about this. So when I started my YouTube channel, about a little over a year or so into it, there was a certain individual that reached out to me and asking for advice on their back pain, and they had told me that they'd been diagnosed with a disc bulge and it was causing back pain, and that they had symptoms that was affecting their life, and they were just looking for some advice from me, and that they followed my channel and watched all my videos. So I had arranged a call with them, and this was when I wasn't offering any services. I just jumped on a video call to try and help them out as best as I could. And they had been being treated, they'd been going to physio, being treated for a disc bulge, but what they described to me wasn't typical of discogenic back pain, the symptoms that they were experiencing. And the final recommendation that I gave to them was, follow up with your physician and get some more testing just to see if something else is going on, because it doesn't kind of resonate or correlate with your typical discogenic symptoms. So there could be another possible explanation or cause of your back pain. And so they did that, and then sometime later, about 6 months, maybe a year later, if not maybe longer, this individual reached out to me again, and that they told me that they had a tumor and it was causing low back pain, and that they had to undergo treatment for that tumor, and that they successfully underwent the treatment and were now in kind of more a stable condition. So the crazy thing is that this individual was diagnosed with a disc bulge, being treated for a disc bulge, yet that wasn't the cause of their back pain, it was a tumor. And why this is a problem is because from the start, if this individual was diagnosed properly with the tumor, then maybe the tumor wouldn't have got as big, or it may not have got as worse in terms of their symptoms over time if it was pinpointed right away and treated right away. And yet they were treated for the wrong issue. Because we have to understand that, yes, disc bulges, many people have them, but not everyone's symptomatic, and it's not always the cause of back pain. So it's an important story just to put into the context of why these more sinister cases or unusual causes of low back pain, can be very dangerous, and we need to be aware of them. Now, they are, yes, very rare, but they do arise, and they can happen, and you need to be aware of them. And it's something that, you do need to kind of push for if something is, you don't want something to go undiagnosed or missed, because that falls on the responsibility of, the person treating you, especially if they're treating you with the wrong plan for the wrong injury. So that you don't want that to happen. And the whole point of it, though, is that, in the case of maybe a cyst or a tumor, or maybe some sort of physiological problem related to the diet, the treatment program is going to be different for those. It's not going to be the same as, treating a disc bulge. They're all going to be different in terms of how your approach to overcoming that specific cause of back pain, and everyone and every case like that is different. So the whole takeaway from this is that the more unusual causes of low back pain, they can happen. Yes, they're rare, but you need to be aware of them, and it's something that you don't want to go unnoticed, or you don't want it to be not diagnosed and get the wrong treatment program. So overall, to wrap up this video, there are unusual causes that do cause back pain. Yes, it's more rare, but they still can happen, and that's why it's very important that you are getting the proper diagnosis and working with your physician or clinician, whoever's working with you and treating you, and making sure that they're doing a proper assessment on you. And, you kind of hope as a patient and with their kind of expertise that they are, but it obviously does happen. And just to be aware that the treatment kind of options the treatment plans for each of those are going to be much different and specific to each cause of back pain. So overall, there are unusual causes of back pain, and we do need to be aware of them. Yes, they are rare, but the quicker we can identify them and overcome them and rule them out, the quicker we can get to the proper program for the individual. So that's it with this video today, guys. If you have any questions, or maybe you have a similar story or something, you went through something similar to the individual I mentioned in this video, I would love to hear your story and to hear kind of what happened with you in your journey. And if you have any comments, questions, or just anything about this topic with unusual cases of causes of low back pain, I'd love to hear about it. And other than that, I wish you guys all the best. I hope you guys are doing well during COVID-19, and we will chat soon, guys. Take care. All the best.